Prime Minister Narendra Modi last evening held a crucial review meeting on the fight against coronavirus. This was to take stock of the situation across the country. He's going to be holding a similar meeting today as well, where the focus is going to be on his Lok Sabha constituency of Varanasi. The meeting will be attended by top officials, by local administration and doctors who are involved in fighting COVID in Varanasi. During the meeting that happened yesterday, the Prime Minister had asked top government officials to ensure maximum hospital beds to treat COVID patients. Reiterating his test, track and treat mantra, Prime Minister Modi asked officials to really boost the installation of medical oxygen plants across the country. He also called for measures to enhance vaccine production. The Prime Minister also reviewed the supply of remdesivir and other medicines which are crucial in the fight against this virus. Let's focus on the state of Uttar Pradesh. Cases are going up. What's even more worrying is that the number of deaths being reported on a daily basis is going up in Uttar Pradesh. With this kind of a situation, the administration has imposed a 24-hour lockdown, a Sunday curfew that's currently in effect across Uttar Pradesh, and these restrictions will be in place till 7 a.m. tomorrow. The Sunday lockdown will be imposed every Sunday till May 15th. All shops, markets, commercial institutions, offices will remain closed. Sanitization work will be taken up by civic bodies during this lockdown. Essential services, however, have been exempted from the curbs. UP on Saturday had recorded 27,357 new COVID-19 infections and 120 deaths. This is the first time the state has witnessed such a high death toll in 24 hours. And let's round up for you all the updates from different cities of the country on the fight against coronavirus and the curbs that are in place. Our team of reporters get you these detailed, comprehensive ground reports.
7,713. That is the number of registered cases in the past 24 hours over here in West Bengal, with 34 deaths. What we do see right now on a Sunday morning in Kolkata Shambazar market area is that a lot of people over here who are present on the ground, they are wearing masks, which is extremely important. This was something that was not being seen rather in the past few months, and maybe that is one of the reasons why there was an upsurge in the COVID cases. Now over here in this market area, this is an extremely crowded area. However, as it's a Sunday morning, there is less crowd, but one very positive thing that we are seeing over here is that people are wearing masks over here. This is a very healthy sign that is being seen right now. What we do see, at least over here in Kolkata's Shambazar market area, that people are, however, even if they are getting out, they are wearing masks. Majority of them are wearing masks, which is a very positive sign. 7713 new cases, 34 deaths. With camera person Santosh Prasad, this is Suryagni Roy, India Today, Kolkata.
Gujarat is amongst the worst affected states like Maharashtra, Chhattisgarh, Delhi, and the districts, particularly in the urban areas, the number of positive cases are coming every day is quite higher. That the situation is really on the ground is grim, and perhaps all the efforts by the administration is being taken. There have been crises of remdesivir injection as well at Surat City Hospital. People even allege that there is black marketing taking place. Yesterday, Crime Branch did carry out a raid and also caught people arrested who were into black marketing of this remdesivir, the injection, which many people required at the moment. The situation is grim on the ground. Reporting at Ground Zero in Surat with Pradeep Gupta, this is Ashutosh Mishra for India Today.
Now, there was a big question about religious gatherings that were taking place in the last few days, even amid this second COVID wave. The Kumbh Mela returnees, now who are heading back to their residences, will have to face a number of rules and curbs that have been put in place by respective governments. In Delhi, for example, the devotees will have to quarantine themselves at home for 14 days and upload their details on the government website. Legal action will be taken against those who flout these norms. Returnees who fail to submit the necessary details will be sent to quarantine centers, so they won't be allowed to quarantine at home. In Odisha, taking an RT-PCR test is mandatory for devotees apart from the 14-day quarantine. The government has also shared a list of people who participated in the Kumbh Mela with authorities to ascertain their location and travel plans. The Madhya Pradesh government, meanwhile, has directed devotees to inform district collectors when they return from the religious gathering. After that, the officials will quarantine them. Gujarat also directed the devotees to take an RT-PCR test before they return to their hometowns. Those who test positive for the infection will be isolated. Lakhs of devotees are participating in the Kumbh Mela every day despite the massive surge in cases. Basic COVID protocols were also given a miss amid the religious gathering.
कुंभ में से जो गुजरात के लोग गए वापस आएंगे उन सभी को पूरा टेस्ट होगा, स्क्रीनिंग होगा और उसमें से जो लोग नेगेटिव निकलेंगे उसको जाने देंगे, जो पॉजिटिव निकलेंगे उसको अलग करते हुए उनके ट्रीटमेंट करेंगे.
Now, the biggest worry perhaps in this current wave that's ravaging and spread across India is the fact that there are many mutant versions of the virus. There's a double mutant variation that's been detected now in several states. At least 10 states have reported this double mutant variation. Now, the reason this is a cause of worry is that it leads to a more infectious version of the virus, which means it spreads a lot faster.
It's a variant of SARS-CoV-2 and it is named double mutant. Called B.1.617, this has been found in more than 60% of the sequence samples from Maharashtra and also detected in 9 other states of the country, say sources within the Union Health Ministry. The government has said higher transmissibility of this variant has not been established yet. But it is of interest in India as it is in other countries like the UK, Australia, Belgium, Germany, Namibia, the US and Singapore, among other countries.
Having 2 of these mutations, which have been seen in other variants around the world, are concerning because there's a similarity in these mutations that confer increased transmissibility, for example, and some of these mutations also result in reduced neutralization, which may have an impact on our countermeasures, including the vaccines.
What is worrying is that it appears to be the most common variant in India, and this also comes at a time when cases are going through the roof in the country. But this is not the only variant detected in the country. There are other variants of concern. At least 33% of samples collected from Jharkhand have shown the presence of the UK variant and double mutating variant. In MP2, double mutation virus in 6% samples have been seen, the UK variant in 5% of the samples. Around 80 districts have the presence of the UK variant. A larger chunk of the UK mutant strain reported in India is predominantly present in Punjab, a state with a grim record of increasing cases and deaths. What is of concern is that there are states like Delhi and West Bengal where presence of both UK variant and double mutant has been seen. Given the exponential increase in cases and also severity of the infection in children in India, experts seem to suggest that it indeed is mutant viruses wreaking havoc.
Because new contagious variants, especially P1, is 2 times more contagious and is much more difficult to control. Now with the B.1.17 UK variant, kids are at higher risk than ever before. That is a known property of B.1.17. People speculated, I speculated for months and months, and now it's been confirmed.
The surge appears to be driven mainly by the more transmissible B.1.7 variant from the UK, which is causing around 40% of cases in Asia, according to pathogen tracking project NextStrain. Another 16% of cases are because of the B.1.351 variant that evolved in South Africa. Cases of the same have been seen in India as well. It's part of the evolutionary biology of a virus to mutate. Hence, there is nothing unusual about the SARS-CoV-2 virus. mutating. What's of significance is whether the mutation then makes the virus stronger or weaker. Does it increase the potential of the virus to cause severe infection or more infections? Very little is known about the double mutating variant. What we also do not know just yet is whether the existing vaccines act against the double mutating variant. In New Delhi with Waqar Ahmed, Sneha Mordani for India Today.
And here's our special COVID segment, Tales of Hospital Horror, heartbreaking stories of apathy, and also that highlight how overburdened our healthcare system is. A fire broke out at a coronavirus-dedicated hospital in Chhattisgarh's Raipur on Saturday. There were 50 patients undergoing treatment at the time of the incident, out of which unfortunately 5 died. A firefighter team rushed to the spot and doused the fire. Local police said that a case of negligence will be registered against the owners of the hospital. The fire broke out due to a short circuit in the ICU and then spread in other wards. Amid reports of shortage of remdesivir vials across the country, 816 antiviral injections have been stolen from a hospital in Bhopal. A case has been registered at the Kohifiza police station against unidentified persons. After the matter came to the fore, Minister Vishwas Sarang said that the perpetrators will be caught. The city has been facing acute shortage of remdesivir injections besides beds and hospital oxygen cylinders. As coronavirus cases soar in the national capital, patients are facing the brunt of the dilapidated healthcare system. Several state-run hospitals are completely overwhelmed by the influx of patients, unable to meet the demand for beds. People were seen queuing up outside the LNJP hospital. This as Delhi reported more than 24,000 cases in the last 24 hours. Patients in Delhi continue to struggle to find beds in hospitals. A COVID patient traveled back and forth to various hospitals in the national capital for 4 straight days. The victim's wife pleaded with hospitals for admission. Her appeals, however, fell on deaf ears. The woman finally breathed a sigh of relief after an NGO came to her rescue and her husband was finally admitted to the Ambedkar Nagar hospital.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.